Hello and welcome to My Health Doctor. We start our series on contraception and birth control measures. So you want to have sex? This video guide can help explain how to stay safe from unwanted pregnancy and in some cases prevent sexually transmitted infections. We will cover the main methods available, how it's used, how effective it is at stopping pregnancy or infections, and what the main risks are. This is not intended to be a substitute for professional medical advice, and always seek advice from your doctor or other health professional. We will discuss the main methods of contraception or birth control: natural, barrier, hormonal, and non-hormonal. These are all reversible methods. However, there are irreversible methods such as sterilization, which we will briefly discuss at the end of this video. Natural family planning is planning around menstrual cycles with sex occurring on days where you are less fertile. The lactational amenorrhea method is reserved for women after childbirth, and withdrawal method is removing the penis just before ejaculation. Using the first and third of these methods can be challenging. It can be difficult to predict cycles, and there is a risk of failure and pregnancy. However, the lactational method can be successful if followed correctly. None of these methods protect against sexually transmitted infections. So what is the way to protect against sexually transmitted infections? Using barrier methods like condoms. This is the only way to prevent infections. So if you are using another method for birth control, you should still use condoms. The most commonly known is the male condom, but there are female versions available. They work by preventing sperm from getting through into the womb. They come with very few side effects, but lots of advantages. There is also a female diaphragm, or cap, which is placed up the vagina just over the neck of the womb, which is also called the cervix. This needs spermicide added to it in order to work. Accidents can happen, such as condoms slipping or breaking, and it also depends on how good the person is at putting the condom on correctly, so it is always advisable to read the instructions or watch an educational video if you're not sure. Now we come on to the hormonal methods. LARC stands for long-acting reversible contraception and use the hormone progesterone. We also have pills, skin patches, and vaginal rings. LARCs include the coil or intrauterine system, injections and implants. They are very effective at stopping pregnancy and can be used for long periods of time without needing to remember to do anything on a day-to-day basis. The coil is inserted into the womb or uterus by a specially trained doctor or nurse and can stay there between 3 to 5 years, slowly releasing the progesterone hormone. Sometimes women use them to help with heavy periods, as well as for contraception. These are just some of the risks of the coil. In rare cases, the womb can push the coil out, which is called expulsion. There is a small risk of pregnancy, and for some women they may experience irregular vaginal bleeding or have no bleeding at all. The progesterone injection steadily releases the hormone between 8 to 12 weeks and can be given in the arm, tummy, buttock or thigh depending on the type of injection. It is very effective and can also be used during breastfeeding. It can delay return to normal periods and fertility for up to a year, so if you are planning on getting pregnant in the near future, you may want to consider this. Some experience irregular vaginal bleeding, weight gain, acne and mood swings. The implant is a small plastic rod inserted into the inside of your upper arm and can stay there for 3 years, slowly releasing progesterone. You won't need any stitches when it's fitted. Periods and fertility return to normal after it's removed. It can cause irregular vaginal bleeding or no bleeding at all. Some experience acne or worsening acne, and it might not work if you are on certain medications such as for epilepsy or HIV, so consult your doctor first. Pills contain artificial versions of our hormones. The combined pill contains both estrogen and progesterone. The progesterone-only pill is self-explanatory, and there are also pills for emergencies, more informally known as the morning after pill. There are different ways of taking the combined pill, but often it is 1 pill a day for 3 weeks, followed by 7 days of no pills, then restarting the cycle. It can help with painful and heavy periods and reduces your risk of cancer of the ovary, womb and colon. There is a small risk of blood clots, but some women may be more prone to them, which is why it is important you consult a doctor first. It can slightly increase your risk of cancer of the breast and cervix for 10 years after stopping taking the pill, but this returns to normal after. The progesterone-only pill, or POP, needs to be taken every day in order to work. There are stricter timings, so you need to remember to take it. There are no breaks in between packs. The POP can be useful for women that aren't suitable for the combined pill. The main issue with pills is forgetting to take them, and there are some rules of what to do if this happens. You can always ask a health professional for advice. Generally, the POP is well tolerated, but you may have irregular vaginal bleeding, spotting, or no bleeding at all. The patch contains the same hormones as the combined pill and is stuck onto the skin every week for 3 weeks, followed by a patch-free week. It's useful as you don't need to remember to take a daily pill, and it still works like normal even if you vomit. It has the same blood clot risk as with the combined pill, so some women may not be suitable. The patch may be visible and it can fall off, making it less effective. Some women get temporary side effects such as headaches, nausea, mood changes, but this gets better. The vaginal ring contains the same hormones as the combined pill and the patch. It's a small plastic ring that sits inside the vagina and lasts 3 weeks, followed by a ring-free week. It's easy to put in and take out, and it still works like normal even if you vomit. Some women experience temporary headaches or vaginal discharge. It also has the same blood clot risk as with the combined pill and patch, so some women may not be suitable. We are now left with non-hormonal methods. These include the copper coil, which is similar to the hormonal coil, and sterilisation, which is mostly irreversible. The copper coil is made of plastic and copper and is placed into the womb by a specially trained doctor or nurse. It releases a small amount of copper over a period of 5 to 10 years and can also be used in emergency situations. It can temporarily give irregular vaginal bleeding with heavier, longer, painful bleeds. In the rare case of pregnancy with the copper coil, there is a small increased risk of the pregnancy being ectopic or not in the correct place. Sterilisation is generally irreversible but a very effective form of contraception, which requires careful thought and discussion with your doctor before you make your decision. For men it is known as vasectomy, and for women it is known as tubal ligation. Although very effective, sterilisation has a small risk of failure. It is difficult to reverse sterilisation, however it can be done in some cases, although success rates can vary. It is a contraceptive method that requires a small operation. The Pearl Index is one way of comparing different contraceptive methods against each other on how effective they are at preventing pregnancy. It gives percentages based on perfect use and for typical use, which is how most people might use it, but it's not without its flaws. So if we used no method at all, it suggests only 15% of people wouldn't get pregnant, and if we compare that to the natural methods and then the barrier contraceptives, we can see the difference. Condoms are much more effective at preventing pregnancy. And when we compare the hormonal and non-hormonal methods, things get even better, with the coils and the implant equally as effective at preventing pregnancy. These figures have been adapted from the Pearl Index to show percentage of people not getting pregnant. I hope this video has been informative about the contraceptive choices available and to motivate you to do your own research for what works best for you. Links to key websites and references will be in the description box below. Thank you for listening. Please subscribe to My Health Doctor and leave a comment below if you have any suggestions for health topics you want to hear about.